So I'm not here to give you a talk about public health. I'm here to give you some financial advice. I thought it would be different because in the spirit of interdisciplinarity that we meet today. And I would like to follow on really from the presentation, the absolutely fantastic presentation from my good friend, the truly inspirational Bronwyn King, who you heard this morning, and the incredible work that she has done. And to look at this issue about, sorry, I need to turn around a little bit because I can't actually read all the bits on the screen down there. Margaret Chan has said, this is an epic battle between the protection of public health, the pursuit of corporate wealth. Public health, we in public health have the evidence on our side. And the right values. The tobacco industry has vast financial resources, lawyers, lobbyists, and no values whatsoever beyond the profit motive. So I want to look at seeing if we can get at them where it really hurts, and the profit motive, and how they actually have what their business model is. And of course, we know what their business model is because they publish it in their portfolio for investors. And essentially, the key part of this is maintaining high profit margins. That's where what they need to maintain their share price, to pay dividends, and to go forward. Now, of course, we can break this down. It's very simple mathematics, a little bit of algebra here. Profits are equal to the price that they can charge minus the costs of production and advertising and whatever else, times the volume of cigarettes that they produce. So it's a very simple relationship. What's been happening to it? What do we see as we look to the future? Well, historically, of course, we've seen that this has been a very profitable industry. Profits have consistently gone up, and that's partly because volume has consistently gone up as well. And as they've moved away from the traditional markets in the high-income countries, they've spread into other parts of the world. They've spread from men to women. One of the major changes in the 20th century was the uptake of cigarette smoking among women, and they have tried to bring in as many groups as possible into expanding their markets. And more recently, what they've been doing is maximizing their profits even more. They've been benefiting from globalization by driving down the cost of production, in particular by moving products away from moving the manufacture away from the traditional high-income countries, at the same time as pushing up prices as a major way of increasing their profits. And by cutting their costs and by increasing their prices, they've been able to increase their income per cigarette, and by expanding volume, they're expanding their profits. And that was great, absolutely fantastic. You can see why anybody would want to invest in this industry. Here was a guaranteed return. You had a product that was addictive. You had a product that was being promoted, not just by the industry, but by corrupt politicians in many parts of the world as well. And I was saying at lunchtime, actually, when we look across the world and we look at the enforcement and the implementation of tobacco policies, we now have more and more evidence that countries that have lax tobacco policies have that for a reason. It's primarily corruption. So when you're talking to governments that find it difficult to implement and enact strict tobacco policies, I think it's worth just pointing out to them that what they're effectively doing on the world stage is holding up a big flag saying, we are corrupt, because there is no other alternative explanation for it. But that worked for a long time. That was great. The profits went up, the volumes went up, and they were able to, they didn't, in fact, need to put up prices for a while. And they could maintain their reasonably high prices. They could maintain low costs by having cartel-like structures. Cartels in terms of the pricing, but also in terms of the manufacture and the purchase of tobacco. They had huge purchasing power. They were able to exploit poor farmers everywhere. And as Bronwyn pointed out, tobacco manufacture, tobacco growing involves extreme severe human rights abuses all through the supply chain. That was fine until this document came along, and this document, of course, challenged all of that. And as you know, this is the Framework Convention on Tobacco Control, which reset the agenda, it reset the narrative. And in particular, as Bronwyn pointed out, it made clear that tobacco is not a product like any others. Tobacco is a different product. It is a product that is designed to kill when used as it's meant to be used. So we should not think of it as being a conventional product. There is an international treaty to restrict its use. There are no international treaties to restrict the use of iPhones. There are no international treaties to restrict the use of almost of anything else. Tobacco is out on its own. The situation that we have today is that profits are still going up for the time being, but that is largely because of increases in price, because the problem the industry is facing is that although they've been able to take costs down, they're only able to take them down so far, and they're having problems expanding their volume. So what they've been trying to do is to compensate for the sales volume decline in the established markets by going into low-income countries. And let's look at this, which is the balance sheet of Philip Morris looking at 2012 and 2013. And we can see that as we look right across the world, in all of the markets, the cigarette shipment volume has been going down. They've still been able to maintain their profitability for the time being, but the volume is going down. What they're also doing, of course, is they're shifting production to low-income countries and to particularly low-paid workers, and they're introducing much more automation, mergers, regrouping of their operations, and we see that in many examples. And of course, one of the ways in which they could exert their power in high-income countries was because they said, we are employing people, we're putting jobs into where I come from, Northern Ireland, for example. Well, not anymore because they've closed that down. They've moved to Vietnam, to China, to elsewhere. But even closing factories in countries like Uganda that are not normally seen as being high-wage environments. So they're getting the prices down, the cost of production down as much as they can, but there is a limit to what they can do. The industry actually has been putting up prices, and it's interesting whenever it is such a strong critic of tax rises. But as you know, here in Australia, even every time that taxes go up, the industry adds a little bit on as well, and of course blames the government and says that the increased price is entirely due to the taxes, but at least part of it is due to their increased profit margins too. And you can see this from their own comments. Since October last year, despite the deterioration in the global economy, we increased prices in most of our key markets, including Argentina, Germany, low-income countries, high-income countries, middle-income countries. In 2008, pricing contributed $1.2 billion to our increased profitability. So they complain about taxes, they complain about the impact of taxes on the poor, but in fact they are putting up their prices and making more profit as a result of that. Pricing is the key driver of revenue and profitability growth in developed markets where industry volumes continue to decline. Small regular price increases, which are sneaked in so that nobody notices them, have been central to our ability to continue to grow profitability. But we then need to look at what some other people are saying, what the analysts are saying. And they're beginning to question this. They're saying, for how long can tobacco companies compensate falling volumes with price increases? Even when selling addictive products, there has to be a limit to pricing power, especially if consumers and governments around the planet are becoming increasingly more conscious about the devastating health consequences of tobacco. So I think that we are actually seeing a point where this sort of the investment opportunities from tobacco really do need to be challenged, certainly in the long term. And I think what we're beginning to move into is a situation where volumes are declining despite their best efforts. Profits are coming down significantly because there's a limit to how much they can increase prices and reduce costs. And if that happens, of course, what will be the result of that will be that share prices will tumble. And if that happens, then you will see the major disinvestment. Now, the industry is compensating a bit and trying to protect itself by substantial buybacks of its own shares, but it can only do that for so long. Ultimately, it has a problem. This is an industry like the fossil fuel industry that is ultimately going absolutely nowhere. So again, we look to the analysts, and what are they saying? Citigroup are saying, taking the very long view, it's hard to ignore 50 years of data. Smoking rates appear to be falling in a series of straight lines if this continues, and so on and so forth. Most terminal values model a constant percentage decline, may never get to zero, but you can see that they're saying that in the long term, this is not an industry to invest in. On the other hand, this is an infinitely adaptable industry. It has changed in many ways, and of course it is looking at new markets because it is now seeing itself in particular in the role of marketing substances, in particular nicotine, but not just. And so you see it trying to get into the cannabis market in Canada in particular. Philip Morris in particular, especially active there. And of course the smoke not burn and electronic cigarettes is the next big opportunity. Despite the now rapidly growing evidence of the harmful effects of nicotine per se, the industry loves to say that it's the tar that kills you and nicotine is harmless. Well, that clearly is not the case, as we're now increasingly seeing. So just to conclude, because this has been a lecture on financial advice and not on public health, I have to include the statutory warning, which is that your investments can go down as well as up. So if you are thinking investing in the tobacco industry or in anybody else, then you should think carefully about where you put your money. Thank you very much.